Hello, my name is Lorena Saavedra. I'm a nutritionist and I'm also a researcher and director of nutrition and dietetics program in Universidad San Ignacio de Loyola, is in Lima, Peru. And today I'm going to talk about the implementation, process, and effects of front of package warning labels in Peru. Well, first, we need to know that these front of package warning labels in Peru have the form of black octagons, and they are used in products that are high in sugar, saturated fat, sodium, and that contains trans fats. These black octagons are not only used in the package of foods and beverages, but they are also used in the advertising of those products. If we want to know a little bit more about this policy implementation, we have to go back 10 years after. This policy was published as a law in May 2013, and 4 years after, the Ministry of Health published the reglement, and then it took 1 more year to publish the manual. Finally, in June 2019, the first phase was implemented, and then in September 2021, the second phase. In parallel, we had 2 more policies. The first one was published in June 2016. It was the gradual elimination of trans fats. And then in May 2018, the sugar sweetened beverage tax increased. During all this period of time, we carry out many studies. Before the implementation of the front of package warning labels, we carry out some studies like an experiment to evaluate the influence of these octagons in adolescents' purchase decision. And also we carry out some exploratory studies to evaluate the food surroundings of, the school surroundings regarding the market of food supply. Then after the implementation, to evaluate the effects of this policy, we carry out several studies like the wage and employment effects on the food industry. We also evaluate the changes in food reformulation, and we also observe the changes in the marketing techniques of the products. We still have some studies in progress, but today we are going to present these results. So first, regarding the employment and wage effects, that is a common narrative of the food industry. We have to highlight that in our country, in Peru, we observe no changes regarding employment, neither wage. For this study, the team used monthly data from the Ministry of Labor for about 100 manufacturing industries related to the food and beverage industry, of course, from January 2016 to February 2020. And the results, as I mentioned, showed that there was no changes in the employment or in the wage or in our country. In addition, there was no evidence of the possible anticipatory effect, as this study used data from previous years. Regarding the reformulation of the products, for this study, we use data from the top-selling foods and beverage using Kantar and Euromonitor data. We established 3 data collections. The first one was the pre-implementation phase, and the second and the third one were the post-implementation phase. The post-implementation data was first collected in 2019, just before the first phase, and the second one was carried out in May 2021, just before the second phase of the law. The main findings that we observed were first the reduction in sugar, but also in saturated fats. And in the case of sugar, mostly this reduction were observed in the beverage. It was very curious because the final median content was just above the threshold. And then the changes in saturated fats were observed, especially in foods. In parallel, we also observed an increase in the use of non-caloric sweeteners, and it was very curious because the one that we observed that increased the most was stevia, this natural non-caloric sweetener, very popular in Latin America, especially in Peru and Bolivia, that those countries we are producers of this non-caloric sweetener. And as I mentioned, it was very curious because then I'm going to show more results related to the claims that were presented regarding stevia, that have this special form, this leaf form related to the natural ingredient. And regarding the products that would carry any kind of front of package warning label, any octanol, we observe changes that we suppose that are related to the reductions in nutrients of concern. In the case of beverage, we observe that from around 60%, the products that carry the black octagons were reduced to around 30%, and in the case of foods, from 82% to 62%. Those changes were observed between the first and the second collection, the pre-implementation and the first post-implementation phase. It is very important to highlight that we did not observe any changes between the second the first post-implementation phase and the second post-implementation phase. The main changes were observed just before between the first and the second one. Then regarding the prevalence of marketing techniques and the changes of health and nutritional claims in the market, well, we use two cross-sectional data collections. The first one was carried in 2019, in March 2019, and the second one in 2020 and 2021. We use data from 2 years because we were limited by the COVID pandemic. We analyzed the presence of marketing techniques that were, for example, cartoons, the presence of actors or any public personnel. Then we also observed, for example, these colorful fonts or any special design in the package that can be considered a marketing technique. And also we assess the health claims, for example, like this one present in this yogurt that is mentioned that contains probiotics and fiber that can help our functional, the gut function. And then also we evaluate the presence of nutritional claims like this one present in a juice, in an artificial juice that is mentioning that it contains no additive, no preservative. The results show that first, the categories with more marketing techniques were especially those that are target to kids, like dairy drinks, especially the chocolate milk, and then also the breakfast cereals. Then we also observe an increase in the use of messages related to non-caloric sweeteners. And as I mentioned before, the increase of the stevia non-caloric sweetener was very high in Peru, and it is also related to this kind of healthy messages because the industry relate the use of stevia as a natural ingredient. Of course, it can be explained, the presence of non-caloric sweeteners can be explained as a technique or a strategy to avoid the octagons, but the problem is that population, our population are not aware of these possible negative effects of the non-caloric sweeteners that are already published by the World Health Organization and the Pan American Health Organization. We also observed that high-end products increase the use of marketing techniques, probably because they want to sell the same amounts before an implementation of the octagons. And it is very curious because not high-end products also increase not the use of marketing techniques, but the use of health claims. So here in Peru, we can suppose that the healthy food market is increasing and there is a great interest in the healthier lifestyle. What about the next steps or the take-home messages? Well, first we have to inform policymakers about these results to evaluate, complement, and also strengthen the current regulation in Peru, and also advise other countries like yours in this process of implementation. For example, we need to aware our Ministry of Health about the use of these non-caloric sweeteners health claims, because even when we know that this is a natural, especially the stevia is a natural ingredient, we know already that they can cause some negative effects in our health as any other non-caloric sweetener. Also, we need to show these results about the SSP tax and the front of package warning label policy that have no effect in the jobs or wages in our industry, in our food industry. Then we also observed some reformulations from the beginning of the implementation. It was very quickly, this reformulation. It is very curious because we did not observe any change in sodium content. As I mentioned, we observed changes in sugar and also in fats, but it did not happen the same with the sodium content. And probably we have to talk a little bit more about this and explore more, but what we suppose is that other Latin America countries that already established many years ago policies related to sodium reduction, they can affect as a spillover effect here in Peru. Probably our products are like a reflection of the changes that happened before in Argentina or Chile or Brazil that already have these sodium policies. And also, we need to review the threshold, because the sodium threshold, even it is the same from the Chilean threshold. If we compare with the Pan American Health Organization thresholds, the Peruvian one is really high in comparison to the PAHO threshold. Then I already mentioned this, the increase of non-caloric sweeteners or non-nutritive sweeteners, and the messages related to them are very special here in Peru. We need to establish more regulations regarding the use of non-caloric sweeteners as happened in Mexico and Argentina. And finally, we also observe and we need to be aware of the new strategies that the industry is using to promote and sell more products with octagons. We observe more techniques, more marketing techniques among these products, but also it is very curious because we observe that there are also more claims, nutritional and health claims in products without octagons. So the market is changing, of course, and probably there is more interest in healthier products. Well, finally, I have to recognize the help during these studies from the University of North Carolina in Chapel Hill, and also here in Peru, the very the job that the Cronitas from the Center of Research based in Universidad Peruana Cayetano Heredia for this study. Thank you.